Hi, my name is Emmanuel Cruz Carrasco. I'm going to read the theory and exercises of chapter 22 and 23. Chapter 22 is Heart and Circulation 1, and chapter 23 is Heart and Circulation 2. Chapter 22, the Heart and Circulation 1. A. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases it may be present even at rest. A patient who is breathless when lying flat, orthopnea, for example, in bed, will tend to sleep raised up on two or more pillows. The abbreviation ACE, OBOE stands for shortness of breath on exercise, or on exertion, or on effort. Patients say, I get terribly short of breath climbing stairs. Doctors can ask, how many pillows do you sleep on? B. Heart rhythm. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 minutes per minute. The heart rhythm may be regular or irregular. In an irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitations. Case 4. A 20-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthopnea, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, which was followed by episodes attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pitting edema. If, when a finger is pushed into the swelling, it causes a small depression or pit. Here we have an illustration of the heart. Sorry for the illustration being mirrored in the video. Now I'm going to read the components of the illustrated heart. We have the aorta, the tricuspid valve, the pulmonary artery, the pulmonary veins, the mitral valve, and the septum. Now I'm going to read the exercises of chapter 22, Heart and Circulation 1. 22.1. Complete the conversation based on the case history in B opposite. Doctor, what seems to be the problem? Patient, I haven't been getting episodes. Doctor, how long have you had them? Patient, for about 6 months, but I have had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. 22.2. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. I'm going to read the 2 boxes now. The first box has the words at, atrial, cardiac, heart, on, beating, premature. The second box has the words output, failure, edema, fibrillation, beats, effort, rest. Now I'm going to read the word combinations. Atrial fibrillation, cardiac output, beating edema, heartbeats, premature beats, heart failure, at rest, on effort. Those were the word combinations. 22.3. Write the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help you. 1. Dysphonia. I have shortness of breath when climbing stairs. Arrhythmia. I feel palpitations while walking. Orthopnea. I am breathless while lying in bed. Edema. I have nasty swelling in my feet and ankles. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60-year-old woman attended her GP, general practitioner's surgery, complaining of breathlessness on exertion. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes of fast heart rate, which lasted 20-30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight. So that was chapter 22, the heart and circulation 1. Now I'm going to begin chapter 23, the heart and circulation 2. A. Physical examination. Medical examination is normally carried out in 4 stages: inspection, looking; palpation, feeling with the hands; percussion, tapping with a finger; and auscultation, listening with a stethoscope. Note the verb is palpate, the noun is palpation, not palpitation. We can see Unit 22 for the difference. B. Examining the heart and circulation. Here is an extract from a textbook description of how to examine the cardiovascular system. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clogging. Feel the real pulse at the wrist and note the rate, for example 60 beats per minute, and rhythm, regular or irregular. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measure the blood pressure and assess the jugular venous pressure, JVP. Palpate chest for the apex beat. The normal position is the feet level intercostal space, 1 cm medial to the mid-clavicular line. Feel for any drills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds. For example, friction rocks, beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and raw. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of systole; pan-systolic, lasting for the whole of systole; early diastolic, mid-diastolic, late diastolic, pre-systolic. Continue with listening at the tricuspid, aortic, and pulmonary areas. Here we have a picture of clubbing, finger clubbing. Again, sorry for the pictures and illustrations being mirrored in the video. We have an illustration on top of a picture of the chest area. Now I'm going to read the information. Areas of auscultation. The letters indicate the approximate position of the heart pulse. Pulmonary valve. P. Pulmonary valve. A. Aortic valve. M. Mitral valve. T. Tricuspid valve. The circles indicate the position for auscultation for cardiac murmurs, indicating valvular heart disease. The ribs are numbered. Now I'm going to read the exercises of chapter 23, Heart and Circulation 2. 23.1. Complete the table with words from A opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb: auscultate. Noun: auscultation. Verb: examine. Noun: examination. Verb inspect. Noun inspection. Verb palpate. Noun palpation. Verb percuss. Noun percussion. 23.2 Put the steps for examining the heart and circulation in order according to the four-stage system. Look at A opposite to help you. The steps are: number 1, inspection. Look for clubbing. 2, palpation. Feel the real pulse. Locate the apex beat. 3, percussion. Measure the heart size. Note any trills. And 4, auscultation. Are there any murmurs? So those were the steps for examining the heart and circulation in order, according to the four-stage system. 23.3 A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was pyrexia with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and rhythm. Her blood pressure was 130 above 80 and her jugular venous pressure or JVP was up 3 centimeters, showing normal movement with respiration. Her peripheral pulses were all present, and there was no central or peripheral cyanosis. Her apex beat was displaced to the anterior axillary line, with still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-diastolic murmurs. Her best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the precordium. Our diagnosis at that time was of mitral stenosis and incompetence, with a recent onset of pericarditis and atrial fibrillation. So those were chapters 22 and 23 of the textbook Professional English Use in Medicine, the Theory and Exercises. Chapter 22 was Heart and Circulation 1, and Chapter 23 was Heart and Circulation 2. Thank you very much for watching this video. My name is Emanuel Cruz Carrasco, and that was the video.